Of the 6 million U.S. heart failure patients, 3 million are symptomatic with an ejection fraction of 40% or less, considered HFrEF. The problem? A dilated left ventricle due to a variety of causes. BioVentrix is focused on developing a platform of LV restoration therapies to address these challenging patients. The most common cause of heart failure is a heart attack that creates scarring in the left ventricle. Almost 20% of heart attack patients present with heart failure within 5 years. Remodeling of the left ventricle occurs as the chamber and its radius enlarge, and its thick muscular wall stretches and thins. The result is a reduction in the heart's ability to pump enough oxygen-rich blood to the body. Patients with suboptimal response to guideline-directed medical therapy or cardiac resynchronization therapy will see their health decline with worsening symptoms, frequent rehospitalizations, and a poor quality of life. There are few opportunities to achieve true remission. The 5-year survival rate is less than 50%. The LIVE procedure using the Revivant TC device is a minimally invasive therapy that treats a dilated left ventricle, which may prove to be a solution for these advanced heart failure patients. The procedure begins with a mini thoracotomy or small incision between the ribs for optimal access to the scar area on the left ventricle. Utilizing a catheter that is advanced through a neck vein, the physician places a small anchor in the right ventricle at the scarred portion of the interventricular septum. A tether is extended through the left ventricle and into the scarred area of the left ventricular wall. An external anchor is then advanced down the tether, plicating or folding the scarred area. 1 or 2 more anchor pairs are then placed along the plicated fold. The left ventricle is restored to a more normal conical shape. The heart beats more efficiently, and the chamber empties more effectively, with limited or no residual blood pooling. Patients can demonstrate significant reductions in their LV end systolic volume index, the leading prognostic indicator to a patient's outcome. With a corresponding increase in ejection fraction, the patient's symptoms ease with a hope for heart failure remission. As a minimally invasive alternative to surgical remodeling, LIVE therapy has demonstrated in-hospital outcomes comparable to established transcatheter aortic and mitral valve structural heart therapies for mortality, bleeding, and stroke. A retrospective view of clinical studies shows 100% procedure success, with low in-hospital mortality and bleeding events and no stroke events. In a population that typically demonstrates a 5-year survival rate of less than 50%, patients treated with LIVE therapy have demonstrated a 1-year survival rate of greater than 90% and a 5-year survival rate of greater than 86%. BioVentrix and LIVE therapy. Achieve heart failure remission through left ventricular restoration.